Hello students, let's discuss today about gangrene. So definition of gangrene. Gangrene is death of the tissue due to loss of blood supply. First is hypoxia, then ischemia, then necrosis, infection or both resulting in decomposition and putrefaction of the tissue. So in simple words, macroscopic death of tissue with superadded putrefaction. So next come to the types of gangrene. Three types of gangrene: dry gangrene, wet gangrene and gas gangrene. First one is dry gangrene. So dry gangrene caused by chronic arterial occlusion, and wet gangrene is caused by sudden occlusion of the arteries. Dry gangrene caused by slow occlusion of the arteries. Dry gangrene seen in diabetes, atherosclerosis, and wet gangrene is seen in diseases like emboli, ligatures, crush injuries. Wet gangrene is seen. Here sudden loss, here slow occlusion of the arteries in dry gangrene. Here tissue is local findings. Tissue is dry, shriveled and black. In wet gangrene, findings is tissue is swollen, moist and foul smelling. In dry gangrene, line of demarcation is present. Here line of demarcation is absent in wet gangrene. Rapid spread and severe toxemia in wet gangrene. So, gas gangrene is caused by Clostridium species bacteria. Severe pain, crepitus. Crepitus is gas under skin. Foul discharge, medical and surgical emergency in gas gangrene. Special types of gangrene: Foreigner's gangrene, diabetic gangrene, pressure sore gangrene. Next come to the management of gangrene. General management, local management, surgical management. So general management: treat shock and sepsis, control diabetes, give antibiotics and analgesics. About local management, wound care and dressing should be proper. Keep affected part clean and dry. Next, surgical management. Debridement means removal of the damaged tissue, revascularization, amputation if required of the part that went into gangrene. Next come to the clinical examination of gangrene. Inspection, color change. First initially it will be pale, later changes to dusky grey and finally will be the black. Why black color? Black color is due to the disintegration of hemoglobin and the formation of iron sulfide. Swelling will be there, discharge, demarcation line in case of dry gangrene. Palpation, temperature, there, loss of temperature, tenderness, loss of sensation, loss of function, crepitus, gas under the skin. In case of gas gangrene, peripheral pulses will be absent. Loss of pulsation, loss of color, loss of temperature, loss of sensation, loss of function is the signs of gangrene. Systemic examination: fever, tachycardia, toxemia. Next come to the homeopathic treatment of gangrene. 5 remedies are there. 1. Arsenicum album. If there is burning pain, restless, offensive discharge and amelioration by heat. Sickle core in case of dry gangrene, cold, shriveled parts, painless gangrene. In arsal, there is burning pain. Sickle core, painless gangrene. Arsal, amelioration by heat. Sickle core, aggravation from heat. Carbovage. Next remedy, bluish black gangrene, collapse state. All the features of shock will be seen: cold temperature, cold clammy skin, cold perspiration. Next, lachesis, septic gangrene, purplish discoloration, and anthracinum, malignant rapidly spreading gangrene. So rapidly spreading gangrene is our wet gangrene in case of anthracinum. So all about gangrene I have discussed: definition, types and management of gangrene, clinical examination, homeopathic treatment of gangrene. So if you like this, if you understand this, please like, share and subscribe my channel. Thank you.